depression, anxiety, inflammation, and chronic infections. I'm primarily going to be going over this information as it relates to depression, but the same concepts can be applied to anxiety and other emotional states. Start with a quick overview of the psychiatric theory of depression, which is that depression is caused by a chemical imbalance in the brain. There is no test whatsoever for this, it's just made-up theory. Most notably, people are told that they have a lack of serotonin in the synapses of the nerves in their brain, and therefore they need to take a drug to fix this chemical imbalance. There is all sort of theory about how these drugs work, that they are inhibiting the reuptake of neurotransmitters in these synapses, but again, this is all theory, none of it's proven. But the fact that people are being prescribed mind-altering medications that affect the nervous system means that we can basically surmise that psychiatric drugs therefore poison the nervous system in order to fix the so-called chemical imbalance, which there is no proof for whatsoever. So we have drugs such as Prozac, which is a serotonin reuptake inhibitor, or Effexor, which is a serotonin norepinephrine reuptake inhibitor, but they're not really, we don't know what they're doing. These drugs are given classifications under the assumption that they're having some type of effect, but basically they are nervous system poisons. And the basic idea is that you poison the nervous system so it's so dysfunctional it can't produce depression or it can't produce anxiety. But in no way is this holistically appraising an individual and giving their body what it needs. I put that quote up by John Bastyr, and it was in the wall of one of the rooms when I went to Naturopathic school. And the basic idea is that the effect of a medication is the totality of the effects. When we use the term side effects, it's implying that a side effect is a lesser effect. But no, the total effect of a drug is everything that it does. And the big problem with these psychiatric drugs is that they are poisons. So they don't just poison the nervous system, they are poisoning the entire body, and they are not moving people towards health. And then there's the question of, do these psychiatric drugs work? And by work, that word should really be put in quotes, because they're not working to make anyone healthy. They're just working to try to dull these symptoms of anxiety or depression. Well, many studies do show no improvement, that they're not really better than placebo. However, if you look a little bit more closely, they seem to work better on people with worse depression. So the worse your symptoms are, then maybe you might get some effect from these improving your mood, but overall it's going to hurt your body because there are multiple side effects, and at best this is only a band-aid approach because it's not really doing anything about the actual cause of aberrant emotional states. I want to relate this to the central thesis of psychiatry, which, if you look over its 200-year-plus history, seems to be the notion that destroying the physical body will somehow create better mental health. So in the 1700s and 1800s, they would just flat out torture people. Then slowly they developed things such as lobotomy, like let's just take out pieces of someone's brain, or electroconvulsive therapy, let's run electricity through the brain. And then they started drugging people. What all of these have in common is the notion that if you bring physical harm to the body, you are improving mental health, but also the notion that the human body is somehow inherently broken or defective, and that it therefore needs to be brutalized in order to get someone to feel better. And now I'm going to move on to what I'm calling the functional medicine theory of depression. This is a way of looking at depression and mental illness in general, which I think really has developed over the past few decades as in natural medicine we have more comprehensive tests that started looking at things like amino acids, and now there are labs coming out with neurotransmitter tests and so forth. And while this is definitely better than the psychiatric model, there are still many shortcomings with it. And the major shortcoming starts right at the beginning. The functional medicine theory of depression basically says depression is caused by a chemical imbalance in the brain. And what they're saying is you give the patient nutrients, especially amino acids, and this will allow the brain to make enough neurotransmitters. Under this model, we have things like you take tryptophan or 5-HTP as a serotonin precursor for depression, or you take tyrosine as a dopamine and epinephrine precursor for energy and depression, or maybe you take folate because you need to improve methylation, and folate also has a role in helping the body produce neurotransmitters. There's magnesium, B6, zinc, DHA, and fish oil for the brain, and other amino acids. And there is a lot of good things going on here. Definitely, if someone is deficient in tryptophan, they are not going to feel that good if they don't have enough raw materials to make serotonin. So I'm not going to bash this as completely invalid. However, it's still a very limited approach. This is actually part of an old lab test that was run on me when I was in naturopathic school, and I highlighted tryptophan just to make the point that if someone runs this test, they can see how much tryptophan they have, and if they are very deficient in it, then absolutely you should take tryptophan, and that can help symptoms of depression or anxiety or some other mental state. However, what about the person who is not low in tryptophan? Do you just continue to give them more and more tryptophan and tyrosine regardless to try to force them to feel better? Is that really how the body's going to work? Again, I don't want to attack amino acid testing, because in certain contexts, when used appropriately, it's very, very important. However, it's just not the entire story. So what is wrong with this nutritional approach? Well, first of all, it's very reductionistic. Reductionism doesn't work for complex systems like the human body. Depression is not a disease per se, it's something that you feel. It's like if you go into your doctor's office and says, my arm hurts. Arm pain is not a diagnosis for anything. That's something that you feel. Something that you feel is not an explanation of why you feel that way. There are numerous reasons why someone may feel depressed. Depression may have its roots in the physical, mental, or emotional planes that we exist in. And also, although this type of amino acid nutritional approach does work for many people, for many other people, it doesn't do anything for them. There is a huge discrepancy between the anecdotal results that practitioners in my field get and the sort of internet hype that you're going to read by going to this website or that website. I'm going to read about this test and this neurotransmitter test and this amino acid test. And these websites are going to convince you that if you're feeling depressed, you need an amino acid test, when that may or may not really be true. And the clinical results that practitioners get when using these sort of methods is not 100%, it's not 90%, it's not 80%, it might be a lot lower, like 50% of people improving. And why are these nutritional approaches limited in success? Well, that's because a strictly nutritional deficiency approach will only help people who are depressed because they have nutritional deficiencies. Unfortunately, it needs to be stated that taking 5-HTP or tryptophan or GABA or any of these other supplements for mood are only going to help if you're deficient in those things. If you're not deficient in tryptophan, taking more tryptophan or eating turkey is not going to help you feel better. If you're not deficient in magnesium, taking more magnesium is not going to help you feel better. If you're not deficient in folate, taking more folate is not going to help you feel better. Now, do I use tryptophan and folate and B vitamins and magnesium in my practice? Yes, because there are times when people need it. But you have to look at the entire picture. So, I don't want to do this, throwing the baby out with the bathwater thing and saying, well, not everyone really gets better with this approach, so I'm not going to do it. That's not what I'm saying at all. The whole point of this presentation is how do we have a more comprehensive approach? So instead of helping 50% of people, we can help a lot more. Now, since most people do have poor diets and most people do have many nutritional deficiencies, this strictly nutritional approach will help people get healthier. But since nutritional deficiency is not the cause of depression in everyone, that's why success is going to be limited. And there is no such thing as the cause of depression in everyone. Depression is a multi-factorial problem. And ultimately, we have to ask the question if this nutritional approach is really getting to the heart of the matter, or is it just the same way of following the psychiatric model, which says in a reductionistic way that mental symptoms are the result of some type of chemical imbalance in the brain, even though we have no studies or tests to validate this whatsoever. So, how does the body really work in regulating neurotransmitter levels with respect to the amino acids we're taking in? Well, this little chart shows tryptophan will be converted into 5-HTP, which is converted into serotonin, and that's converted into melatonin. But nutrients are not drugs and do not force drug-like responses. So if someone happens to be low in serotonin, taking more tryptophan or 5-HTP is only going to result in higher serotonin levels if the body's self-regulatory mechanisms want to convert those precursors into serotonin. So it's not just a question of do you have the amino acids or do you have the cofactors like B6 and magnesium. If in the body's own internal logic it does not want to convert 5-HTP to serotonin, you're going to have a very difficult time getting more serotonin by taking more and more 5-HTP. That's just not how the body works. The body is engaged in complex self-regulation using nutrients according to its own intelligence. So we have to look at the body and say, what does this body want to do given its limited resources and energy, and how do we assist the body in whatever processes it's going through, instead of coming up with our theory from the outside and trying to force that theory onto the body. Our bodies, ourselves, are part of nature. Nature is a dictatorship. You work with nature, or you try to fight against it and you suffer. And when you try to force reactions on the body using drugs or nutrients, you're often going to be unimpressed with the results. With that in mind, I'll pose the question, assuming that someone is low in serotonin and depressed, are they depressed because they are low in serotonin? Or are they low in serotonin because the body is producing depression for some other reason? And while a straight tryptophan deficiency could definitely cause someone to be depressed because they're low in serotonin, I would argue that in the majority of the cases, even if we could demonstrate that the brains of depressed people were low in serotonin, ultimately they would be low in serotonin because the body is producing depression for some other reason, or as a consequence of some other reason. So we need to switch our paradigm when it comes to this. This notion that we have biochemistry that works in a very physical, deterministic way, and that determines our emotions, that has no credibility whatsoever. Not only is it have no credibility in any type of truly holistic model, even within psychiatric research, this has no credibility. This model was invented as a way for drug companies to sell stuff like Prozac on TV commercials. And what happened in the world of functional medicine and a lot of people in natural health was they picked up on the propaganda from the TV commercials, and then they just started saying, yes, biochemistry determines our emotions. Take more 5-HTP, take more tryptophan, take more tyrosine. And they took some valuable nutritional information and threw it way out of context. A whole truly holistic model looks at the totality of oneself on our mental, emotional, and physical planes and says, where is the problem and how do we go in and help this person on wherever that problem is? Factors to consider. In a case of depression, a truly holistic practitioner does not assume there is an amino acid deficiency. This may be true, and it's not necessarily wrong to run an amino acid test. However, that's just one consideration. A complete history should be taken. This includes psychological history, physical injury, surgeries, infections, nutrition, and biochemistry. All of these things are considerations. One does not treat depression, but really can only help improve the health of someone who feels depressed. Depression is an abstract feeling. You treat the person, not an abstract feeling. Like if someone walks into the office with arm pain again, you don't treat arm pain. If it's a fracture, you have to put them in a cast and heal the fracture. You don't give them Novocaine. Ultimately, depression is a symptom of poor health. So you holistically appraise someone and say, why are they in a state of poor health, and help them. What is responsible for neurotransmitter regulation? The only thing that can properly regulate your brain levels of neurotransmitters is your own brain. No practitioner is going to look over some lab test, even if such advanced testing existed, which is quite controversial, and I'm not going to get into that right now, and then use amino acids and other supplements to fine tune your neurotransmitter levels. That's not how the body works. If you double your intake of tryptophan, you're not doubling your brain levels of serotonin. You could have no effect on serotonin. The body is complex, dynamic, self-adjusting, adaptive. If due to some deep trauma, psychological or physiological, the body is thus producing symptoms of depression, is it realistic to cure them by figuring out their neurotransmitter profile and micromanaging it via outside regulation? No, it's not. And this is why no practitioner is ever going to be able to finally regulate your neurotransmitter levels from the outside based upon some lab test. It's because symptoms, including mental symptoms, are the body's best attempt to maintain health in the face of adverse conditions. For example, if someone is smoking and they get bronchitis, they don't have some random lung disease. Their body has bronchitis because they've been smoking. If you get a sore throat, it's not because your throat is suddenly dysfunctional. It's because there's an infection coming in and your body is producing the sore throat in order to clear it. If you eat bad food and you start vomiting or have diarrhea, it's not because you have some random dysfunctional digestive system, that it's because you have something coming in and the body's producing diarrhea or vomiting in order to get rid of it. Likewise, if someone is under prolonged psychological trauma, they're going to develop depression or anxiety or post-traumatic stress disorder as an adaptive response to that stress. So ultimately, our symptoms are the body's attempt to deal with outside stressors. So therefore, you have to basically look at what's going on and give the person the support that they need. You don't fight depression. You support the body and you support the mind that's going through this. On a very fundamental level, it's impossible to have respect for the body as a complex, dynamic, self-correcting, self-regulating system and also think it's susceptible to extreme variations of neurotransmitter levels depending upon whatever random amino acid supplement someone is taking. Of course, you might need an amino acid supplement if you're deficient in amino acids. But if someone's going through post-traumatic stress disorder due to severe trauma, don't expect to give them an amino acid supplement that's just going to normalize the neurotransmitters regardless of everything else that they've gone through. So let's consider the intelligence behind depression. In certain circumstances, depression is actually an adaptive response. For example, if there's a lot of stressful events going on, in terms of survival, it might be better for people to go in a bit of a more hibernation mode and stay low rather than expose themselves to the outside stress. This may have made more sense 15,000 years ago than today when someone's stress is going to work every day and that's not ending. But at that point, we have to support them through that process. And we have to understand that there's a logic in terms of what's going on. Also, consider a fever or illness. The body may be saving its limited pool of resources to do something else. Let's consider how someone feels when they get the flu. When acutely ill, your body doesn't want you to feel happy and energetic. It wants you to conserve energy to fight the illness. So what happens if you're ill all the time? There's a chronic infection and you're not aware of it. Maybe you're chronically depressed because you have a chronic infection. I'm going to put the link in the description below, but let's look over some recent information from Neuroscience. So this is coming right from a mainstream conventional publication. Stressful events promote neurochemical changes that may involve the provocation of depressive disorder. So stress can make us feel depressed. That should be pretty obvious. Indeed, depression and chronic stressor exposure typically reduce levels of growth factors, as well as impair processes of neuronal branching and neurogenesis. So what they're saying is that chronic stress and depression will have their physical correlates in terms of how the brain works. The article goes on. Several pro-inflammatory cytokines, such as interleukin-1, tumor necrosis factor, alpha, and interferon gamma, influence neuronal functioning through processes involving apoptosis, toxicity, oxidative stress, and metabolic derangement. What this is basically saying is pro-inflammatory cytokines, or chemicals your body makes when you're under inflammation, have negative effects on how your brain is actually functioning. Furthermore, support for the involvement of cytokines in depression comes from studies showing their elevation in severe depressive illness and following stressor exposure. So what they're saying is they know from studies that people who are more depressed have more of these inflammatory cytokines. So there is a relationship between inflammation, infection, and depression. This isn't so much a research study, but more of an article up on Psychcentral. Chronic infection may spawn depression. This is about research that demonstrates the robust link between the immune system and the nervous system, a connection often ignored by immunologists and neurologists. There's a problem in science today where we zoom in on these little processes and no one's looking at the big picture. So we can have immunologists doing their thing and neurologists doing their own thing, and they're not looking at how everything is interconnected. And if you don't understand the vast interconnectedness of how the body works, then you really don't understand how the body works. I don't care how in-depth knowledge you have on one little process. So this person goes on to say, for years, no one considered an infection somewhere in the body could affect the brain. Well, maybe in the field of immunology or neurology, no one was considering this, but using basic naturopathic principles that the body is a complex dynamic system and you don't treat an illness, but you actually treat the person, that's all you really need. So while it's great that information is coming up backing the connection between an infection and the depressed state, if someone is truly following a holistic model where they treat the person, if they see someone who's terribly depressed and go through an assessment and see illness and infection, they're going to know, treat the person and treat the illness, and that person's probably going to get better. So this is backing up naturopathic philosophy. It's not really new, groundbreaking information for anyone following a holistic model. There are lab tests that can back this up. This is from what's called an organic acid test. The top two markers are for the catecholamine pathways, epinephrine, dopamine, norepinephrine. Then the bottom four markers are actually signs of the serotonin pathway. If someone is taking their tryptophan and 5-HTP and converting that into serotonin, then that 5-hydroxyindyl acetate is going to be elevated. But these three bottom markers, quinonate, quinonate, and picolinate, excuse my pronunciation, which probably isn't that correct. Well, if those bottom three markers are elevated, but the 5-hydroxyindyl acetate is low, then someone might not be converting their 5-HTP or tryptophan into serotonin. They might be converting it into inflammatory cytokines. So using this basic lab test, it can demonstrate that taking lots of 5-HTP does not mean you will make more serotonin. In an inflamed person, it may just end up making more inflammatory cytokines. This is actually an old lab test of me when I was in naturopathic school, and on this lab test, I kind of saw that taking more 5-HTP really wasn't causing any type of clinical effect or improvement for insomnia, but it was making my body produce a lot more 5-hydroxyindyl acetate as my body was dumping the byproducts of that supplement I was taking, but no clinical effect. I'll finish up by talking about acute and subacute infections. We basically all know what signs of an acute infection is. Heat, pain, swelling, redness, run to the hospital, get an antibiotic for something. But what about infections that do not have such symptoms? There are many places in the body where you can have a foci, which is basically a place of impaired functionality, where the body may be harboring toxins or infection. And these can linger in the body and disrupt how well we feel, even though we don't have many signs of acute infection constantly. This can be, for example, post-root canal, post-tonsillectomy. Many people have their tonsils taken out. They don't realize, well, then their body has decreased ability to remove bacteria and viruses, and that can affect them systemically. Chronic Epstein-Barr that comes and goes. Inflammation in the digestive tract. There may be chronic sinus infection, which generally means that there's a chronic infection internally in the digestive system and the body's just using the sinuses as a route of elimination. Issues with the lungs, bronchitis, gallbladder. Sometimes people suddenly get an inflamed gallbladder, they run to the hospital, have their gallbladder removed. That didn't come out of nowhere. It just wasn't recognized for what it was until they had to have their gallbladder removed. Spleen, major center of lymphatic and immune system activity. So we can have places throughout the body where we're actually harboring latent infections, and the body will respond to this. And it can cause symptoms of depression. This doesn't mean everyone who's depressed has this problem, but this is another explanation. Again, there's no the cause of depression. So we have to look at multiple different facets, and this is just one of the multiple considerations that I would go through if I'm working with someone who comes in complaining about depression. We also need to consider poor immune system function in the person who never gets sick. Is this a sign of a strong immune system or one that is too weak to even mount a response? Sometimes the sickest people are the ones who come in and they say, I don't understand this. I never got sick. I haven't gotten sick in years. And all of a sudden they get this huge illness. Or maybe someone never gets sick, but they're terribly depressed. And they think, oh, it's not my immune system. I never get sick. It is the immune system. It's an immune system that's so beaten down that it can't even mount a response. And there are many people who are that sick who think that they have ideal health. The worst examples are those who suddenly get cancer, and they'll go in and say, I don't understand how I get cancer all of a sudden. I never get sick. Well, that's why, because you've been so sick that your body couldn't produce a symptom until it produces cancer. But the good news is that there are many natural therapies that can be used to support the body in overcoming chronic or latent infections. And for a really deeper understanding of how many of our symptoms can actually indicate deeper problems, I would refer you to my video on homotoxicology, which I think goes through this in a very succinct way. So I'll finish with the question, do all depressed patients need immune system support? The answer is no. What all depressed people need is support for whatever problem is causing them to feel depressed. And since it's a multi-factorial problem, I can't say what that is. Maybe they need a therapist instead, or maybe, they need immune-boosting herbs. It's different for everyone. But the core concept is that you do not treat depression. You only can treat the person who feels depressed. And the only person who can get someone out of a depression is that depressed person. It's not going to be some master practitioner with their charts of amino acids. It's going to be the patient working in concert with their body and the healing power of nature and support calming in and giving that body what it needs that is going to facilitate the healing process. You cannot take a sick person, regardless of if it's a chronic infection or if it's post-traumatic stress disorder or if it's a bad diet or any of these things. You cannot take a really sick person and throw a bunch of amino acids at them and expect them to be healthy. That's completely out of context. That's taking nutrition out of context. And I don't want to degrade nutrition or nutritional therapies or amino acid testing, as I think these are great things. I use them. I love them. I just simply want these practices to be put in proper context instead of being used as some type of mono treatment without even looking at the whole person. Okay, that's it. Bye.